The Be More Healthy Expo is sponsored by GBMC, Maryland Physicians Care, and Toyota.
Well, 7:44, and knowing what is happening with your body is the best way to stay healthy and avoid concerns called preventative care. But what screenings do, and what screenings should you get, and at what age? Here now, Dr. Barry Lewis with the Maryland Physician Care System here too. And thank you so much for coming in.
Oh, I'm glad to be here. Thank you very much.
We're talking about screenings. We knew you hear about them, and you start hearing about, okay, there's this screening, that screening. What is some of the most important screenings that you tell your clients?
Well, really, the screenings depend a lot on a couple profiles. So it could be based on age, it could be based on gender, or maybe if you're pregnant, and so there are lists. So it's based on the condition or profile that you have. So it's really important that you have a relationship with your provider, and then they're the guide for assisting you with your screenings.
And also when you go into the office, though, where you're talking to a medical assistant or whoever taking the history is very important then to kind of set the tone for what screenings you do need then, being completely honest with them in that room.
Absolutely. Having a relationship with your physician, whether it's a provider or nurse practitioner, it's essential.
Yeah.
And I learned a lot of that. I learned that with watching my family, actually not just being a physician, but watching other people. If you have that relationship, they feel comfortable, you feel comfortable, you're able to share the necessary information so that you're guided to the necessary screening that you should have.
I think you'd be better in tune then with your provider here to kind of say, okay, let's go with the best avenue and let's not waste anybody's time here. When we do talk about the screenings, though, you went through a list there, I mean, the genders and the age, and you do hear certain recommendations from certain providers, and they may differ from other providers on when to get things done, age-appropriate screenings. Can you tell us a little bit about that?
Well, that's a very interesting point because there are a number of health agencies that put out guidelines on screening. So one agency is the USPSTF, United States Preventive Task Force,
Gotcha.
Preventive Screening Task Force. And so they are the basis, or they create guidelines for you to follow. But what happens is you have different health conditions. So based on that conversation with your provider, you might get guidance to do something a little bit different. So as far as blood pressure screenings, so if you have a family history of high blood pressure or cardiac disease, then you will be expected to do a little bit of testing or screening a little bit earlier than someone who doesn't have that history. Or if you have a family history of cancer, if female with breast cancer or ovarian cancer in the family, you might be asked to do screenings at a younger age than someone who does not have that history.
Going back to that history, why it's so important here. Dr. Lewis, tell us a little bit more about what the healthy groove is and why your Maryland Preventative Care covers that.
Well, Maryland Physicians Care provides not only the acute care that people expect. If you get sick, you go into the hospital, or if you go to the doctor's office, we provide a network that provides those services, but there's also a significant emphasis, like we've talked about here, on preventive care and wellness. And so Healthy Groove is an innovative program in the sense that it is an outreach program that goes out to the community. It's an opportunity for members in the Maryland Physicians Care program to find out that living healthy is fun and easy. It's not about going and sitting in that doctor's office. As much as I know about healthcare, I get nervous when I go sit in that doctor's office. But it's about going out into the community. We have this great van, opens up into all these activities, and you get education on all those
And coming up
areas.
here in just a little bit, March 7th, you'll actually be at the Be More Healthy Expo with that van, and we'll be able to see some of that interactions here at our Healthy Expo. Is that right?
Absolutely.
Okay, great. That's perfect right there.
Yeah.
Well, thank you so much. Dr. Lewis, we appreciate your time and get your input on the times and how we need to talk with our providers. In fact, don't miss the Be More Healthy Expo Saturday, March 7th at the Baltimore Convention Center. Jonathan, let's find out a little bit more about what it's going to be like out there as you step outside.